ಹಾಯ್ ಹಲೋ ನಮಸ್ಕಾರ, ನಾನು ನಟಿ ಭಾವನಾ ರಾವ್. ಇವತ್ತು ನಮ್ಮ ಜೊತೆ ಡಾಕ್ಟರ್ ತೆಹಸೀನ್ ಇದ್ದಾರೆ. ಅವರು ಕಾರ್ಡಿಯೋವ್ಯಾಸ್ಕ್ಯುಲರ್ ಸ್ಪೆಷಲಿಸ್ಟ್. ಕೇರಳದಿಂದ ಸ್ಪೆಷಲಾಗಿ ನಮಗೋಸ್ಕರ ಬ್ಯಾಂಗ್ಳೂರಿಗೆ ಬಂದಿದ್ದಾರೆ. ಕೆಲವು ತುಂಬ ಇಂಪಾರ್ಟೆಂಟ್ ಅವೇರ್ನೆಸ್ ಕ್ರಿಯೇಟ್ ಮಾಡೋಕ್ಕೆ, ಒಂದಿಷ್ಟು ಹೆಲ್ತ್ ಇಶ್ಯೂಸ್ನ ಎಸ್ಪೆಷಲಿ ವುಮೆನ್ ಹೆಂಗಸರಿಗೆ ಅವ್ರು ಏನು ಇಶ್ಯೂಸ್ ಫೇಸ್ ಮಾಡ್ತಾರೆ, ಪೀರಿಯಡ್ಸ್ ಆಗಿರ್ಬೋದು, ಬೇರೆ ಮೆನ್ಸ್ಟ್ರಲ್ ಸೈಕಲ್ಸ್ ಬಗ್ಗೆ ಆಗಿರ್ಬೋದು. ಬಟ್ ಮೇನ್ ಇಂಪಾರ್ಟೆಂಟ್ ಇಶ್ಯೂ ತುಂಬ ಜನಕ್ಕೆ ಗೊತ್ತಿಲ್ಲ. ಆ ಟಾಪಿಕ್ ಬಗ್ಗೆ ನಾವಿವತ್ತು ಮಾತಾಡ್ತಾ ಇದ್ದೀವಿ. ಅದರದ್ದು ಪ್ರಿಕಾಷನ್ಸ್ ಹೆಂಗೆ ತೊಗೊಬೋದು ಮತ್ತು ಅದ್ರ ಕ್ಯೂರ್ ಏನಿದೆ, ಅದ್ರ ಬಗ್ಗೆ ಎಲ್ಲ ಮಾತಾಡೋಣ. ಹಾಯ್ ಡಾಕ್ಟರ್ ತೆಹಸೀನ್, ಹೌ ಆರ್ ಯು?
Good.
ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್ ಫಾರ್ ಜಾಯ್ನಿಂಗ್ ಅಸ್.
You're welcome.
ಸೊ ಡಾಕ್ಟರ್ ತೆಹಸೀನ್ ಯೂಟ್ರಿನ್ ಫೈಬ್ರಾಯ್ಡ್ಸ್ ಬಗ್ಗೆ ನಮಗೆ ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ಯೂಟ್ರಿನ್ ಫೈಬ್ರಾಯ್ಡ್ಸ್ ಇಟ್ಸ್ ನಾನ್ ಕ್ಯಾನ್ಸರಿಯಸ್ ಗ್ರೋತ್ ಇನ್ ಆರ್ ಯೂಟ್ರಸ್. ಇದು 25% ಮಹಿಳೆಯರಿಗೆ ಈ ಪ್ರಾಬ್ಲಮ್ ಇದೆ. ಇದರಿಂದ ಎಕ್ಸಸ್ ಫ್ಲೋ ಆಗುತ್ತೆ ಆ್ಯಂಡ್ ತುಂಬ ಮೆನ್ಸ್ಟ್ರಲ್ ಪೇನ್ಸ್ ಆಗುತ್ತೆ, ಕ್ರ್ಯಾಂಪ್ಸ್ ಆಗುತ್ತೆ. ಸೊ ಅವ್ರು ಹೇಳ್ತಾ ಇರೋದು 25 ದಿವಸನೂ 30 ಡೇಸಲ್ಲಿ 25 ಡೇಸು ಪೀರಿಯಡ್ಸ್ ಆಗುತ್ತೆ ಸುಮಾರು ಹೆಂಗಸರಿಗೆ. ಸೊ ಇದನ್ನು ಟ್ರೀಟ್ ಮಾಡೋದು ಹೇಗೆ, ಇದರದ್ದು ಸಿಂಪ್ಟಮ್ಸ್ ಏನು, ಇದೆಲ್ಲ ವಿಚಾರ ಡಾಕ್ಟರ್ ತೆಹಸೀನ್ ನಮಗೆ ತಿಳಿಸ್ಕೊಡ್ತಾ ಇದ್ದಾರೆ. So tell me, what is the treatment for this? What is the procedure?
Actually, if a patient diagnosed with uterine fibroids, for example, if the patient is having a symptom like excess bleeding and abdominal pain, for the first thing that we take is an ultrasound scan.
Okay.
The ultrasound scan will give you the diagnosis that these are due to the fibroids. Once the fibroids are detected, usually they will go to a doctor, a gynecologist or a general physician. They will give some medicines. And if it is not working, the existing treatment modalities are to remove the fibroid alone surgically or to remove the entire uterus. So that is what is happening. The first one is called myomectomy, the second one is called hysterectomy. It's a surgery. So instead of this surgery, we can do embolization to treat these patients. That is the point.
Okay.
So what we are doing is, we are going through the wrist. Like you have seen the cannula that we are putting the IV fluids, right? Like this small tube we are introducing here. We are taking that tube under X-ray. We can see through the X-ray where the tube is going, and through this wrist we are going to the chest and going to the uterine artery. So don't think this scary thing.
No, it is not at all scary.
Because the entire process will
It's
take
like drips.
Yeah, that's it.
Yeah.
But you are taking this catheter there into the uterine arteries. And once we identify the artery which is supplying the fibroids, we will give an injection that the artery is stopped, the blood supply is stopped. So the blood supply to the fibroid is stopped completely. So without blood supply, the fibroid tumor cannot survive. It gets damaged, it starts shrinking, and within the next cycle, the patient will get the benefit.
Oh, just one time. And he'll just after this one time procedure, the patient is fine.
Yeah.
Oh, that's great. ಸೊ ಇವ್ರು ಹೇಳ್ತಾ ಇದ್ದಾರೆ ಸರ್ಜರಿ ಎಲ್ಲ ಮಾಡೋ ಅವಶ್ಯಕತೆ ಇಲ್ಲ. UFE ಒಂದು ಪ್ರೊಸೀಜರ್ ಇದೆ. ಇವ್ರು ಹೇಳ್ತಾ ಇರೋದು ಸರ್ಜರಿ ಮಾಡೋ ಅವಶ್ಯಕತೆ ಇಲ್ಲ. ನಾರ್ಮಲ್ ಡ್ರಿಪ್ಸ್ ಥರ ಇರುತ್ತೆ. ಆ ಡ್ರಿಪ್ಸ್ನ ಹಾಕಿದ್ಮೇಲೆ ಒಂದು 15 minutes.
Usually. It was I told you, right? That is when we started this procedure, we were taking around 2 hours.
Yeah.
Then we changed the procedure into multiple levels and did around 3 we have almost completed 3,000 cases. So with that experience, now we can finish within 15 to 20 minutes. But previously it was taking a lot of time.
Yeah. So you made it easy for us.
Yeah.
But more work for you, I guess.
No,
before.
Before. Now it is we trained ourselves in such a way that we can finish within 15 minutes.
Yeah. ಸೊ ಆ ಸರ್ಜರಿ ಅವಶ್ಯಕತೆ ಇಲ್ಲ. ಅದಕ್ಕಿಂತ ಮುಂಚೆ 2 hours ತೊಗೊತಾ ಇರ್ತಂತೆ ಈ ಪ್ರೊಸೀಜರು. ಬಟ್ ನಮಗೋಸ್ಕರ ದೇ ಹ್ಯಾವ್ ಸಿಂಪ್ಲಿಫೈಡ್ ದ ಪ್ರೊಸೀಜರ್. 10-15 ನಿಮಿಷದಲ್ಲಿ ಈ ಪ್ರೊಸೀಜರ್ ಮುಗ್ದೋಗುತ್ತೆ. ಒನ್ ಟೈಮ್ ಪ್ರೊಸೀಜರ್ ಇದು. ಇದು ಮಾಡಿದ ತಕ್ಷಣ ನೆಕ್ಸ್ಟ್ ಸೈಕಲಿಂದಾನೇ ದ ಪೇಷಂಟ್ ವಿಲ್ ಬಿ ಪರ್ಫೆಕ್ಟ್ಲಿ ಫೈನ್. ಆಮ್ ಐ ರೈಟ್? Okay, so now main important thing, how much does this cost?
It is compared to the usual treatments like surgery.
Okay.
So whatever the cost will be different in Kerala, different in Bangalore, and different I'm working in Dubai.
Okay.
I'm working in Oman, working in Bangalore, in Chennai, and Trivandrum, and in Calicut.
Okay.
So all these areas I'm doing.
Okay.
Everywhere the price is different.
Prices is different.
But what I see is the price is comparable to the surgery.
Oh.
Same to surgery.
Okay. So what is the recovery time for the patient?
There is nothing like that. I'll tell you the whole story. There is a table where the patient will be walking in, lying down, we are talking about where are we coming from and all those things, and they'll take all the history and all those that. But by that time, by finishing that, the 15 minutes will be over. We'll take out the catheter. I'll ask the patient, you can go and rest in your room. That's it. There is no ICU, there is no recovery, nothing.
Nothing.
Like that. Nothing like that.
So from the next day only the patient can do
Anything.
No more patient.
No, it's not a patient.
Yeah, not a patient.
Anything. They can do anything.
Or their regular activities
Yeah.
and all.
The thing is, the procedure will finish within 15 to 20 minutes. By that time, the blood supply is gone, right, into the fibroids. So the fibroids will start start shrinking. That time, the patient will have abdominal pain. So that abdominal pain will be happening inside the room when their family members are around. So they are also okay with it. And if the pain is more, we'll give injections. There are not much pain, we'll keep them under observation for 24 hours. So usually there will be pain, abdominal discomfort. For that, we'll give injections.
Okay. So it depends on the individual.
Yeah, depends on the individual, their capacity to bear pain, and it depends on the size of the fibroid, the number of fibroids, all those factors. Very small fibroids will not have much pain, but bigger fibroids can have. But they are in the hospital, so we can give just injections. So that's only for 12 hours. After 12 hours, this shrinking will stop. Then the patient will be absolutely okay. And next day evening they can go home, and there is no scar, nothing like that. So after 2 weeks they can't even find out where did I prick them. So it's a very simple procedure.
So actually many people ignore I mean now ivaga tumba ಹೆಂಗಸರು health awareness ಎಲ್ಲ ಕ್ರಿಯೇಟ್ ಮಾಡ್ತಿದ್ದಾರೆ, and they are also very health conscious. But still, I feel this kind of awareness is very important.
Extremely important.
Yeah.
People don't know what
People
is
don't
embolization, and even doctors don't know what is embolization, because this is not trained in MBBS curriculum. So when we were doing MBBS, I recently knew about this, and we started around 6 years back. If you ask me about embolization 10 years back, I didn't know what is. I have heard something like that.
Correct.
So and there are some misconceptions about this the procedure and all. So people think that it's a big procedure. It's not. It's a very simple procedure. Extremely simple procedure.
So doctor, now tell me, suppose the person has other diseases, or like hypertension and diabetes, overweight, underweight, all these things also count when you're going into a treatment. So is it okay?
Actually, in such conditions, fibroid embolization is the treatment of choice, because we are not going for any anesthesia. Anesthesia is not there. So all this risk comes with anesthesia. If the patient has got heart disease, if the patient has got hypertension, diabetes, COPD, lung disease, or if they are on blood thinning medicines after angioplasty or a valve surgery, all these things, we don't have to stop any medicine, because we are not cutting the chest or the abdomen. So we are just breaking only, and so it's very safe in such cases. No problem.
So can you just elaborate on what are the advantages or disadvantages between the surgery and the
compared to surgery, there are so many differences. One, it's not a surgery, it's only a procedure. It takes only 15 minutes. No anesthesia required, and no ICU stay required. Only 24 hours in the hospital. And immediately after the procedure, patients can do any activity. There is no rest required. And multiple fibroids can be treated in a single sitting. And the risk of this procedure is 1/10 of the surgery. Is 10 times safer than surgery.
Okay.
Because you don't, you're not cutting,
anything,
you are not taking an anesthesia and all. So it is 10 times safer than surgery. So these are the main advantages of this procedure.
Okay.
People are afraid of fibroid.
That's because as soon as I told you, right, as soon as we go to the doctor, they'll say it's tumor, and the tumor, that they have to say that it's not this tumor, it is so and so. That explanation is required. So basically ಹೆದರ್ಕೊಳ್ಳೋ ಅವಶ್ಯಕತೆ ಇಲ್ಲ. ಈ ಥರ ಏನಾದರೂ ಎಕ್ಸೆಸಿವ್ ಬ್ಲೀಡಿಂಗ್ ಆಯಿತು, ನಿಮಗೆ ಈ ಥರ ಪೀರಿಯಡ್ಸ್ ಕಂಟಿನ್ಯೂಸ್ ಆಗ್ತಿದ್ರೆ, ಕ್ರಾಂಪ್ಸ್ ಆಗ್ತಿದ್ರೆ, ತುಂಬ ಪೇನಲ್ಲಿದ್ದರೆ ನೀವು ನಿಮ್ಮ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗ್ಬಿಟ್ಟು ಕೇಳಿದಾಗ ಟ್ಯೂಮರ್ ಅಂತ ಹೇಳಿದ್ರು ಹೆದರ್ಕೊಳ್ಳೋ ಅವಶ್ಯಕತೆ ಇಲ್ಲ, ಬಿಕಾಸ್ ಇಟ್ಸ್ ನಾಟ್ ಕ್ಯಾನ್ಸೀರಿಯಸ್. ಇದು ಫೈಬ್ರಾಯ್ಡ್ ವಿಚ್ ಕ್ಯಾನ್ ಬಿ ಟ್ರೀಟೆಡ್ ಇನ್ ಅ ಸಿಂಪಲ್ ಪ್ರೊಸೀಜರ್ಲಿ ಮಾಡ್ಬೋದು. ಆ್ಯಂಡ್ I wanted to share this, doctor, with you, because many women they just ignore a lot of, even if they have excessive bleeding, they sometimes tend to ignore, or maybe they shy away.
That is basically, they are trapped actually. One side, is their symptoms. The other side is the scary surgery. What can they do?
And sometimes
They have to opt between these two. One side there is a surgery where there is anesthesia, risk, weight, they are resting and all those things. These ladies will be in their 30s or 40s. They'll have kids. They have to take care of their husband. They have to take care of their their parents sometimes, and they'll be working also. How can they do a surgery and take rest for 3 weeks or 1 month? It's not possible. So what's the option? Just to suffer. So in such cases only this embolization is coming into picture, where they don't have to take any rest. 2-3 days they can go to work.
And I think they shy away also.
Yeah, that is one another reason. They think that this is normal. It's not normal. And once some of the patients comes to us with a hemoglobin of 5 or 6, something like, they will be like pale white. Their hair is gone, skin texture is gone. They are like looks like old people because of iron deficiency and all. And they can't do anything. They will be breathless while doing something. They are breathless, tired, and no one will understand their problems. Even a partner who is very understanding, after a few months, maybe 6 months, after 1 year, he'll also get fed up. And every month it's coming, right?
Exactly.
So every month is coming. So he also gets fed up. So these people are actually isolated.
And they have a lot of mood swings for sure.
Of course, because they are sick, they can't take care of kids and all. So they'll that guilt also come back.
Correct.
I couldn't do well. Then that guilt also come back.
Correct.
And somebody will be criticizing also.
So women go into depression also.
It's a terrible thing. So their quality of life becomes very terrible. So with a simple procedure, 15 minutes procedure, 1-day hospital, the issues they were suffering for the last few years, we can treat within 15 minutes.
So our symptoms na recognize ಮಾಡಿ ಲಾಂಗ್ ಪೀರಿಯಡ್ಸ್, ಕ್ರಾಂಪ್ಸ್ ಜಾಸ್ತಿ ಆಗ್ತದೆ, ಇಗ್ನೋರ್ ಮಾಡೋಕ್ಕೆ ಹೋಗ್ಬೇಡಿ. ಬಿಕಾಸ್ ನಮ್ಮ ಕ್ವಾಲಿಟಿ ಆಫ್ ಲೈಫ್ ನಮ್ಮ ಕೈಲೇ ಇರೋದು. ನಮ್ಮ ಪೇನ್ ನಮಗೆ ಮಾತ್ರ ಗೊತ್ತಾಗೋದು, ಬೇರೆಯವ್ರಿಗೆ ಯಾರಿಗೂ ಗೊತ್ತಾಗಲ್ಲ. ಆ್ಯಂಡ್ ಪ್ಲೀಸ್ ನಾಚಿಕೆ ಪಟ್ಕೊಂಬೇಡಿ, ಅದರಲ್ಲಿ ಏನಿಲ್ಲ ಹೋಗಿ ಹೇಳ್ಕೊಡೋಕ್ಕೆ ಡಾಕ್ಟ್ರ್ ಹತ್ರ ಏನು ಪ್ರಾಬ್ಲಮ್ ಆಗ್ತಿದೆ ನಿಮ್ಮ ಹತ್ರ ಅಂತ. ಬಿಕಾಸ್ ಐ ರಿಮೆಂಬರ್ ಐ ಹ್ಯಾಡ್ PCOS. ಇಟ್ಸ್ ಲೈಕ್ ಆನ್ ಆ್ಯಂಡ್ ಆಫ್. ನೌ ಐ ಡೋಂಟ್ ಹ್ಯಾವ್. I had few months back and all those things. My symptoms were I maintain my diet really well. I exercise really well. All of a sudden, I started eating a lot. And sometimes I would not eat anything. And I was like, something is wrong. And too many mood swings and all those things. I was like, something is wrong. Let me just go get myself checked. And I started getting my irregular periods also. So then it was detected, okay, PCOS and all. In fact, even thyroid, I detected in a very early stage. I'm not at all a sweet tooth. I don't eat sweets at all. Suddenly I started craving for sweets, and I'm like, no, this is not me. That's how I. So ನಮ್ಮ ಬಾಡಿನ ನಾವು ರೆಕಗ್ನೈಸ್ ಮಾಡ್ಕೊಬೇಕು. We have to be sensitive towards
now
the
this
body.
easy, no? To check a fibroid is only ultrasound.
It's very easy.
Yes,
ಒಂದು ಅಲ್ಟ್ರಾಸೌಂಡ್ ಮಾಡಿಸ್ಕೊಂಡ್ರೆ ಗೊತ್ತಾಗುತ್ತೆ ನಿಮಗೆ.
Simple.
Yeah, exactly.
So thank you, doctor, so much for letting us know about this procedure, about this uterine fibroid. Many people wouldn't know also about it. So finally, what are your last words for our viewers about this?
People are scared about fibroids. The point I just wanted to tell you is that nobody dies because of fibroid. The only issue is fibroids will reduce your quality of life. So what we are trying to do is we are bringing back the quality and joy to your life with a simple procedure which takes only 15 minutes. So you don't have to worry about fibroids anymore. As the technology is advancing in multiple areas, in every area we are seeing the computers are changing, the phone is changing, your cars are changing, roads are changing, train is changing, everything is changing. Likewise, the medical care is also changing. So we have new technologies, new procedures for the all disease which can cure the disease in few minutes. So don't be scared about fibroids.
KH Hospital, in association with Access Hospital, we are unveiling UFE treatment for uterine fibroids. So you want to tell something, doctor?
No, actually we started already did some cases, and this is official inauguration. And we are getting good inquiries, and already the patients are very happy. Initially they were traveling to Kerala, so now I am here, so people don't have to travel to Kerala. We can do it from here itself.
So Access Hospital alli procedure available ಇದೆ, and you are opening a lot of other.
We are planning to start in multiple centers. In hospital we will be starting soon, and in Astor also we will be starting soon. and so many other centers we are planning.
All the best, doctor.
Thank you.
And successful agide almost now, almost 95% of
Yeah,
the cases are successful. You know, they have done more than 3,000 surgeries.
It's procedures.
Procedures, sorry. Oh, yeah. Procedures they have done, and wishing good luck to you.
Thank you. Thank you.
ಸೊ ಇವತ್ತು ನಾನು ತುಂಬಾ ಕಲ್ತ್ಕೊಂಡೆ, ನನಗೂ ಗೊತ್ತಿರಲಿಲ್ಲ ಯೂಟ್ರನ್ ಫೈಬ್ರಾಯ್ಡ್ಸ್ ಬಗ್ಗೆ ಎಲ್ಲ. ಟ್ಯೂಮರ್ ಅಂತ ಹೇಳ್ತಾ ಇದ್ರು. ಸೊ ಇದು ಆ ಥರ ಕ್ಯಾನ್ಸರಿಯಸ್ ಟ್ಯೂಮರ್ ಅಲ್ಲ ಯೂಟ್ರನ್ ಫೈಬ್ರಾಯ್ಡ್ಸ್. ಅದನ್ನು ಟ್ರೀಟ್ ಮಾಡ್ಬೋದು, ತುಂಬ ಸಿಂಪಲ್ ಪ್ರೊಸೀಜರು, ಸರ್ಜರಿನೂ ಬೇಡ. ಸೊ ಹೆದರ್ಕೊಳ್ಳೋ ಅವಶ್ಯಕತೆ ಇಲ್ಲ. ಆ್ಯಂಡ್ ಪ್ಲೀಸ್ ನಾಚಿಕೆ ಪಡ್ಕೊಂಬಿಡಿ, ಡೋಂಟ್ ಶೈ ಅವೇ. ನಮ್ಮ ಹೆಲ್ತು ನಮ್ಮ ರೆಸ್ಪಾನ್ಸಿಬಿಲಿಟಿ. ಆ್ಯಂಡ್ ನಾವು ಖುಷಿಯಾಗಿದ್ದರೆ, ಹೆಲ್ದಿ ಆಗಿದ್ದರೆ ನಮ್ಮ ಫ್ಯಾಮಿಲಿನೂ ಖುಷಿಯಾಗಿರುತ್ತೆ, ಹೆಲ್ದಿ ಆಗಿರ್ತಾರೆ. ಸೊ ಐ ಥಿಂಕ್ ಎಲ್ಲರೂ ಈ ಪ್ರೊಸೀಜರ್ನ, ಯಾರಿಗೆ ಪ್ರಾಬ್ಲಮ್ ಇದೆಯೋ ಅವ್ರು ಈ ಪ್ರೊಸೀಜರ್ನ ಡೆಫಿನೆಟಾಗಿ ಟ್ರೈ ಮಾಡಬೇಕು. ಬ್ಯಾಂಗ್ಳೂರಲ್ಲಿ ಆಕ್ಸಸ್ ಹಾಸ್ಪಿಟಲ್ನಲ್ಲಿ ಪ್ರೊಸೀಜರ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಇನ್ನೂ ಹಲವಾರು ಮಲ್ಟಿಪಲ್ ಸೆಂಟರ್ಸಲ್ಲಿ ಈ ಪ್ರೊಸೀಜರ್ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಸೊ ದಯವಿಟ್ಟು ಏನಾದರೂ ನಿಮಗೆ ಈ ಪ್ರಾಬ್ಲಮ್ ಇದ್ದರೆ ದಯವಿಟ್ಟು ಹೋಗಿ ಟ್ರೀಟ್ ಮಾಡ್ಕೊಳ್ಳಿ. ಈ ಪ್ರೊಸೀಜರೇ ಮಾಡಿ, ಬಿಕಾಸ್ ಇದು ಮಿನಿಟ್ಸಲ್ಲಿ ನೀವು ರೆಡಿ ಆಗಿಬಿಡ್ತೀರಾ. ಸೊ ಐ ಆಮ್ ಗೋಣ ಸ್ಪ್ರೆಡ್ ದ ವರ್ಡ್. ನಾನು ನನ್ನ ಫ್ರೆಂಡ್ಸ್ಗೆ ಇಲ್ಲ ನನ್ನ ರಿಲೇಟಿವ್ಸ್ಗೆ ಯಾರಿಗೆ ಪ್ರಾಬ್ಲಮ್ ಇದೆಯೋ ಡೆಫಿನೆಟಾಗಿ ಅವ್ರಿಗೂ ಹೋಗ್ಬಿಟ್ಟು ಹೇಳ್ತೀನಿ. ಆ್ಯಂಡ್ ನೀವು ಈ ಅವೇರ್ನೆಸ್ನ ಕ್ರಿಯೇಟ್ ಮಾಡಬೇಕು. Thank you, Dr. Tahsin, for giving us so much knowledge and letting us know about this procedure. Thank you to Access Hospital. Thank you to Karunya Hrudayalaya Hospital. ನಮಗೆ ಈ ಪ್ರೊಸೀಜರ್ ಬಗ್ಗೆ ತಿಳುವಳಿಕೆ ಕೊಟ್ಟಿದ್ದಕ್ಕೆ ಆ್ಯಂಡ್ ಈ ಪ್ರೊಸೀಜರ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ದಕ್ಕೆ ಬ್ಯಾಂಗ್ಳೂರಲ್ಲಿ. ಸೊ ಲೆಟ್ಸ್ ಅನ್ವೀಲ್ ದ ಸರ್ವಿಸಸ್ ಆಫ್ UFE in Access Hospital, Whitefield, in association with Karunya Hrudayalaya Hospital. So thank you so much, and take care. Bye.